Hey guys, welcome to Meds Made Easy. My name is Tarun Verma. Today we're going to be talking about Paxil, also known as Paroxetine. That's a generic name. It is an antidepressant, can be used for a lot of different things. You talk about like general anxiety disorders, PTSDs, various levels of depression. Essentially it's a mood stabilizer. So that's mood stabilizer is kind of the main heading in which all of these things come under it. It's an SSRI, fancy terms, serotonin selective reuptake inhibitor, blah, 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 blah. Essentially what that means is it increases serotonin in your brain. What is serotonin? Serotonin is the neurochemical that induces happiness. So more serotonin, happier you are. So that's what it does. Let's see here. I'm not going to go over dosing strategies because depending on what you're taking it for, what your diagnosis is, your dose could vary a lot. There's also the controlled release versus immediate release versus the suspensions. So everything's kind of haywire when it comes to the dosing. Even the peak concentration. So generally you're going to see it kind of kick in about heavily in about 6 to 10 hours depending on the version you have. If it's controlled release, it'll take a little bit longer. If it's the immediate release, in about 6 hours it'll really kick in and you should feel it. Let's see here. It has a black box warning. If you've seen our other depression videos, you'll know that all of these medications carry that warning, and essentially it causes suicidality in patients. Sounds weird, we can never explain it. There is no proper explanation for it, but essentially if you're on antidepressants, it can cause additional or severe suicidal thoughts. Sounds like it wouldn't make sense. Why would you have suicidal thoughts if you're on an antidepressant? Yes, we understand that there's that conundrum there, but we can't explain it in the medical field. There may be some doctors who will do a better job, but from a pharmacy standpoint, it's just something that we warn people about. Let's see, it does go through your liver, so if you're on any medications that also go through your liver, you need to make sure you let your doctor know. You generally don't see this in children, in pediatrics. This is generally for adults, but not always. If a child has failed therapy on different antidepressants, then they could be on this one, but generally you just don't see it for that purpose. For women that are pregnant, you do not want to take this medication. It crosses the placenta, it can get into your baby, and frankly, if your baby is not born yet and it's inside of you, it doesn't need antidepressants. It's pretty happy. Okay, it's eating all the time, it's swimming around all the time. There's no reason for this baby to be depressed. So yeah, so you don't want that crossing through your placenta. Let's see here. If you choose to get off this medication for any reason, you have to do the taper system to prevent withdrawals. Okay, so don't just stop this medication cold turkey. That's a huge no-no. Don't do that. You have to taper off. Usually ask your doctor about it, but what you'll do is you'll taper off your dose, half the dose over the first week, and then it takes about 2 to 3 weeks to really taper off. But it all really depends on how long you've been on it. If you've been on this for years, a couple of weeks probably might not cut it. You probably need to make sure it's longer. If you've only been on it for a couple of months, yeah, like a 2-week wean-off period is probably appropriate. But again, defer to your doctor for all of these questions because they're just too in-depth for me to kind of go into without a specific case. I think that kind of does it. I'll list some basic side effects here. Other than that, it's a pretty tolerable drug. It's on the older side of the antidepressants that are out on the market. So, you know, we used to see it a lot back in the day. Nowadays, we kind of see it. There's some doctors that are used to prescribing that medication. They're comfortable with it. But really, there's a lot more other medications out there that people are on, has a better side effect profile. This is kind of an older one that just we found better substitutes for. But I think that's about it, guys. If you have any questions, concerns, leave them down in the comments. Subscribe to the channel. We're going to keep churning out more content for you guys, more drugs, more videos. So we'll see you next time on Meds Made Easy. Bye.